Thank you. Good morning, everyone. First, I just want to acknowledge my partners, my good partners in this and other efforts, Susan Hillis and Janet Saul from CDC. Actually, Susan was the lead on the contribution to this project that we worked on with Linda and others. But first, I want to start by telling you a story. A couple weeks ago, my wife was out of town. I was watching my 5-year-old daughter, Maya, and I had put her to sleep. And about 2 hours later, she woke up and she was screaming. And she was calling out. I wish I could say she was calling out for her dad, but she was calling out for her mom. And I ran upstairs to her room and picked her up in my arms. And I felt her, and her heart was just pounding, and she was shaking. And she apparently had a dream, and I calmed her down and got her back to sleep, and she was fine. But it made me think about the experiences of children that are abused. What about a little boy whose father beats him indiscriminately, and the fear he feels in his body when he doesn't know if he's going to be hit that evening or not? What about the girl, the adolescent girl that's been sexually abused by a boy in the neighborhood and feels the shame and humiliation of that experience? What do they feel in their body as they experience this and live it out? What about children that are emotionally abused? They're told they're not loved, that they wish they never existed. How do they feel in experiencing that every day or every week in their lives? My point is that these experiences, and I know you can feel these things as I say them in your own bodies, these experiences, as Dr. Nelson just said, get under the skin. They get into our bodies through their impact on the brain, and they can have profound effects on health and HIV in particular. So how often do children experience violence and abuse? We estimate crudely and conservatively that over 1 billion children experience or witness violence or abuse each year in the world. That's half the world's children. The data I'm showing you here come from the violence against children surveys that have now been done, and this is the first 7 countries in which they've been done. This is a national survey that's done in this country within the context of a global partnership called Together for Girls, although we also are very concerned about violence against boys. It brings together UNICEF, WHO, PEPFAR, UNAIDS, UN Women into a global partnership to really focus on this issue. And the data collected in these surveys help to inform that effort and inform activities on the ground in these countries. This chart shows the findings, as I said, from the first 7 countries. And if you just focus on those countries in Africa, in other words, putting aside Haiti and Cambodia for a minute, you can see that about 20 to 40% of girls in those countries experience sexual violence during childhood. That includes forced sex, unwanted attempted sex, unwanted sexual touching, and pressured sex, such as a teacher saying, if you want good grades, you'll have to have sex with me, things of that nature. This tends to peak in these countries during adolescence. So when we talk about gender-based violence, we have to remember that a lot of gender-based violence begins in childhood, starts in childhood. The perpetrators tend to be boyfriends or males from the neighborhood in which they live. So that's sexual violence in these countries. If we take a look now at physical violence, and this is physical violence reported by both boys and girls, that's perpetrated by parents, other adult caregivers, or authority figures, primarily teachers. And what you can see is that from 40 to almost 70% of both girls and boys experience some sort of physical violence during childhood. Now, this is moderate to severe physical violence. We don't measure in these surveys spanking. It's more mild forms of physical violence. This starts with kicking, beating, choking, whipping, those types of violence. So I talked a little bit about sexual violence and physical violence by authority figures and caregivers, but this is only part of the violence that children experience. They witness violence in their homes between parents. They suffer bullying. They can be emotionally abused. I didn't talk about emotional violence. There's also neglect. These are just two types of violence that children are exposed to. You know, we often talk about epidemics in public health, but I'm beginning to think that violence against children is endemic, not epidemic. 50% of the children in the United States have been exposed to violence in the last year. So this is very much part of the lives of children. But we're also learning that exposure to this violence has profound effects on health. Certainly effects on HIV, we'll talk more about that in a second, but also on mental health, reproductive health, diseases and injuries, impacts in terms of diabetes, cancer, and heart disease, that these early exposures, through their impact in the brain and various systems that are sort of controlled by the brain, the endocrine system, the stress regulation system, the immunization system, the immune system, has an impact on all these different types of health outcomes. In particular, it has an impact on HIV, as I said. And there's four avenues or paths through which we think of that it can impact HIV. One is, of course, through direct transmission. And this is particularly important in children, which is female children who physiologically are more vulnerable to acquiring HIV during sexual intercourse because of their age, their stage of development. So direct transmission is an important avenue that can happen through sexual assault. Also, adolescent girls that, for example, are in relationships that are violent, physically violent relationships, may not be willing to negotiate safe sex. So their ability to negotiate sex is compromised in those contexts. Also, we know from looking at street children, studies of street children, that a high proportion of them are driven from their homes by the experience of violence, driven into environments that are in which they're much more vulnerable to HIV. And then also that the exposure to violence actually increases risk behaviors like not using condoms and having multiple sex partners that can contribute to HIV. It's also true that the direction can go the other way. Lucy Kluver has done some important work on how AIDS-affected children are at greater risk for abuse and hunger that can lead to transactional sex, and then also increase risk again for HIV. This relationship between exposure to violence and HIV is actually very strong when you look at the literature. It's based on studies in both violence against women and violence against children. But when you look at the criteria for causality in terms of this research, you find that there is certainly evidence of biological plausibility. There's evidence that there's a temporal relationship. In other words, violence precedes HIV. The strength of the relationship is strong. There's consistency across many studies in terms of this finding, and we also find evidence of dose-response relationship in terms of the frequency of violence exposed to and HIV. Going back to the Violence Against Children survey, this is from the Swaziland study. And here we looked at the association between the girl's experience of sexual violence and its relationship to a variety of health outcomes. But you can see that those girls exposed to sexual violence as a child were almost 4 times greater risk of HIV and other sexually transmitted infections compared to those who were not exposed to such sexual violence. And also you see the association with a variety of other health outcomes is substantial as well. Consistent with that chart I showed you earlier about the relationship between violence and a whole range of health outcomes. In Tanzania, we found that young adults, both girls and boys, that were exposed to sexual violence as a child were twice as likely to not use or use condoms infrequently during the past year. You find the same exact chart if you look at multiple sex partners and the association there. And lastly, I just want to point out that these long-term health consequences are also associated with physical violence, emotional abuse and neglect, not just sexual violence. That those factors can also contribute to risk factors for HIV, such as drug use and other risky sexual behaviors. And the evidence is very strong for this connection. This data come from a meta-analysis of studies that have looked at these relationships. So in conclusion, one of my favorite quotes is from Jack Shonkoff, who says that one of the most powerful ways to change the world is to make it better for kids. And I would amend this a little bit based on what we've all been talking about, and that is that one of the most powerful ways to change the world is to create safe, stable, and nurturing families and environments for children. And I think that's a theme of what we've all been talking about. Thank you very much.